many times we have seen that, in pregnancy, instead of singleton baby, we have twins baby, So parents are, obviously overexcited to know that they are twin babies, because, it's double, they have the happiness. So, but at the same time, the pregnancy can a little bit more challenging when compared to a singleton pregnancy. So the gynecologist and the obstetrician, when they do a sonography, that is the time when we come to know around 7 to 8 weeks of gestation that you have a twin pregnancy. So accordingly, the care is done for those mothers. So some of the problems which can mother face during twin pregnancy is like, again, prematurity, because the mother's abdomen gets full quickly, and there are risk of delivering the babies early. So prematurity is one of the complication which mother can have. Other complications like differential growth of the twins. One of the baby is growing better, the other baby is getting compromised. So this differential growth can be present, because of the nutritional and the circulation of the placenta of both the babies. So there are a lot of few challenges, but twin pregnancies can be managed in a with all the support by the obstetrician, and most of the time the outcomes are better. So yes, there are few challenges, but one has to be optimistic, and it's a very common to find twins pregnancy, these days. What problems they face, once they are born. So during birth, it's important that we have a bigger team to take care of twin pregnancies. So we need two doctors each for one of the babies. So the pediatrician should be, according to the number of the babies. The number of nurses to look after the babies has to be more at the time of delivery. So that has to be taken care, and the resources also required has to be kept at the same proportion. So, and these are the babies who will require frequent admission in the neonatal intensive care unit, because as I mentioned that they can be born preterm also. But if they are not preterm, and if they are more than 35 weeks of gestation, then they can be taken care along with the mother in the postnatal ward. So babies can stay with the mother provided they are more than 1800 gram or 2 kg, and they are more than 35 weeks of gestation. And they can be taken care. They can breastfeed. They can be given, nutritional support as per their requirement. Sometimes these babies may need sugar monitoring to check for low blood sugar, and they have a little bit higher risk of jaundice as they are born preterm, so their weight is less sometimes. So these are the few things which we need to take care when the babies are born, as a twins. The one of the important complication which I would like to mention here is twin to twin transfusion. So what happened in this condition is that they have a common placenta. So what we describe as monochorionic. So they have a common placenta, and sometimes the blood flow to these babies can be different, and one of the babies become extra in size, that its weight is more, and can put pressure on the baby's heart and lead to cardiac failure. And the other baby who is getting less circulation can develop growth retardation and can be more smaller in size compared to the other babies. So along with that, twin to twin transfusion can also lead to certain circulation compromise to some of the organs of the baby. So this needs to be taken care. So in such situation, what we advise to the parents is to get evaluated by a fetal medicine expert who can sometimes do interventions to prevent such vascular compromise in the babies. So this is one of the complications which we need to look at. But if the twin babies, they are born with two separate placentas and two separate what you call fluid bags, then they are much safe and can deliver near term to term as well. In the beginning, as I mentioned, that there can be challenges during the delivery in the NICU or in the postnatal ward, right? That they have to look after, two babies. So in that situation, the care can be sometimes challenging, but at the same time, as I mentioned, that it can be easily manageable, and and with little bit of extra support, these babies do really very well. And as I mentioned, that there can be more admissions in NICU, there can be more, care required during the first few days of life. But and another nutritional challenge which a mother can face is feeding the two babies. So exclusively breastfeeding is possible even if the mother has two babies. Sometimes, if there is a lag in the lactation, then supplements may be required for the babies, either in form of formula feed. Yeah, but it's important to take care of the nutrition of both the babies, and the mother has to be given lactation support. We have lactation specialists available in the hospital who can teach mother how to feed both babies together. We describe it as a football position where the mother can breastfeed both the babies together, and this can take care of nutrition of both the babies. So yes, there can be challenges faced by mother, but with the support of the doctors and the nurses, the family can learn to take care of twins. And later on in life, every care remains the same. They need vaccination, they need regular growth and development monitoring. And I have many twins babies in my follow up, and they are doing as like normal babies. So it's I think parents need not to be worried when they have twin pregnancies. They just need to put some extra effort. One thing, when they are expecting twins, you should remember that your pregnancy is slightly high risk. As I mentioned, that there are few risks which are associated with the twin pregnancies. So you need to be in a very regular antenatal checkup by your obstetrician. Go for your sonographies as per the appointment given to you, and take care of your health properly to prevent, a few of the complications. And be in touch with the hospital which has level 3 neonatal care facility, so that in case if a baby is born, your babies are born early, then they can be provided the right care in that hospital itself. So sometimes, babies are delivered at smaller nursing homes, and despite being high risk, and then they are transferred later on when the babies are born preterm or when they have complication. So this transport by an ambulance sometimes can be challenging for these babies, and sometimes can result in some harm as well. So if your twins carrying twin pregnancy, better to register yourself at a facility which has a neonatal intensive care unit and is able to provide the treatment even in case of babies require level 3 care. And second advice would be that during in the nutrition, so try to learn the best nutrition which can be given to your babies. Try to learn more about breastfeeding in advance, so that when your babies are born, you are able to, produce enough milk. You know the right technique of feeding, and with the help of the nurses and lactation specialists, you will be able to breastfeed both your babies. And if any advice is required, then you can take proper help from the doctors looking after your babies.